COVID-19 test results for 11th December show 702 new cases confirmed, and this high rate of infection is worrying authorities, especially the Ministry of Health. This high rate of infection requires the highest level of responsibility on the side of everyone to observe preventive measures and guidelines set by the Ministry of Health.
Averagely, these days, ICU has about, HDU has normally about, at Mulago has average like 140 patients. ICU, it depends on the number of people who are under intensive care. But as you've seen, there are extra ICU beds that have been prepared to take care of any people who deteriorate and would need ICU.
Mulago National Referral Hospital is currently overstretched with many patients referred from all corners of the country.
The doctor of duty is here assessing patients, and these are patients who have come for inpatient care. When we see these patients, he will choose who goes to HDU, who goes to ICU, who goes on the general ward. So patients usually start at this point, and then the respective ward where they're supposed to go is chosen by the admitting area, by the admitting doctor. At every minute, in 24 hours, we have someone stationed here. We have a doctor, we have at least 2 nurses, and we always have at least a flow of patients all the time.
Okay. The criteria depends on...
So the criteria of who chooses, who goes to HDU, ICU, general ward depends on the severity of the illness. The doctor assesses the patient, how severe is this patient, and then they choose which ward the patient goes to.
Mulago COVID-19 Treatment Center now runs 3 units: intensive care unit, high dependency unit, and general.
Right here is the main HDU, the level 3 HDU. This is the entrance to level 3 HDU. The most sick people, maybe most sick people, are brought to level 3. Yes, we have level 2 and level 3, but level 3 has people who are more sick than level 2. So
you cannot appreciate the work health workers are doing in treating COVID-19 patients until you reach here at Mulago COVID-19 Treatment Center. The good news is that those who need oxygen can adequately have it following the installation of 4 oxygen plants at Mulago Hospital.
So as you can see, we have different sources of oxygen for our patients. We have oxygen from the wall. This is directly from the plant that is piped direct here through tubes. And we have oxygen in cylinders. So sometimes patients need a lot of oxygen, and we have to supplement them. We shall use the one in the wall to give up to maybe 15 liters of oxygen, and then we add from the cylinders to give 5. Most of the patients who are in this unit are on 20 liters of oxygen per minute, and that's why you can see the different sources. You have the wall and then the cylinders. So each of those patients having those 2 sources is on 20 liters of oxygen per minute.
Government is equally feeling the strain in terms of treating COVID-19 patients because it is expensive.
This is ideally a very expensive venture. COVID-19 is a very expensive disease. But all our patients that you've seen in our wards are getting care free of charge. The patients admitted in Mulago are taken care of by the government of Uganda, from feeding to all the necessities, including drugs and everything. So the government is taking over the charges of these patients. But in private facilities, this care in an HDU can go up to about 5 million, and the minimum is 3 million from the private facilities around Kampala. Care in ICU is about 5 million per day in private facilities around Kampala for COVID-19 patients. But here, the government is taking care of all the costs.
The Ministry of Health is now calling on the population to observe COVID-19 preventive measures, which include proper wearing of masks, social distancing, and avoiding crowded places.